Global health feels like it's a burgeoning community on this campus.
Most people are involved in the program because they have a genuine interest in these problems.
They might have different perspectives, but that only helps you educate yourself.
It's just been really fun to find that on this big Princeton community, that there is this smaller community that I really connect with.
It feels like I'm part of a group of people, and I think a big reason for that is the core courses.
We really emphasize the core courses. Everybody has to take them their junior year.
Critical Perspectives of Global Health gives you this framework to really, look at global health and see there's these issues of ethics. There's issues in the laboratory.
I'm all for the qualitative, like that's what I do, but I really like the epidemiology because I guess I didn't appreciate enough like the more quantitative parts.
The epidemiology class is evidence-based, it's numbers-driven.
You can use that to like legitimate more strongly like certain issues or causes or like reasons why you need to intervene in a situation.
The most fun part of GHP 315 was getting to do the final project.
I think I was the only anthropology major, and I had a chemistry major and an economics major.
We hear, early on, their first few meetings, there's some tension, there's some clashes. They don't really know how to talk to each other. The natural sciences say you don't know how this disease works, and the social sciences say you have no sense of the context and the complexity on the ground.
When is an economist going to be able to engage in anthropological work? It just really doesn't happen.
Like you can start thinking about problems in different ways from hearing other people's arguments. And you start seeing the limitations in your own arguments.
And I think that is really the beauty of interdisciplinary work.
Just feels very dynamic.
The lunch colloquia and the panels, I think that those are they're really a great opportunity for us to, see it firsthand.
Make it feel like more than just an academic program.
There's so many opportunities, both in and outside the classroom to really explore health topics.
Last summer I went to Vietnam.
I was down in Costa Rica.
I went to Boston and I was working at Boston Healthcare for the Homeless program.
In Guatemala City at an HIV/AIDS clinic.
My research project was to look at historical epidemiological data, but I was going on rounds at the hospital every morning.
I was primarily a research intern, but I also did a million other things.
So what stuck with me was seeing how all of these problems that you learn about in the classroom really came together in real life.
Before Costa Rica, I really, I thought I knew these diseases. I thought I knew about, how these affect people.
The hospital was unlike anything I had ever seen before.
You're shadowing the physician and you're, helping treat patients and you're getting medications and explaining how to take them to patients.
It's been really cool to position what the patient said about themselves and about their medications and their treatment against what their clinician said.
You can only learn that with that kind of field experience.
I think it's difficult to find like that kind of more nuanced understanding of a field, and I think that the certificate allows you to explore that in global health.
Some of the conditions they see in their summer research experiences are just shattering.
After my junior year, I went to Sierra Leone.
A big benefit was working with other students in the GHP program.
I think we were all shocked by how little public health infrastructure or services there were.
We implemented a pilot program for smartphones.
The goal was to have community health workers triage symptoms and diagnoses in the field to then refer them to a clinic.
While we were there, everybody was getting it. It seemed like it was functioning.
Getting to engage with the community health workers was just, I think, really special, even though we're working with something that they're clearly thinking, gosh, this is not working in our community.
Looking back, we understand the demand it places on the community health workers to go from house to house that frequently.
I really suffered from that, of thinking we had all these lofty goals and nothing's working.
That's sort of the tough way to learn.
My job was to slow them down and to get them to think about what they were seeing and to move from kind of shock or a kind of judgment of the situation because it didn't match their expectations to an ability to anticipate, accept, learn from, even enjoy the unexpected. There's no easy way, in fact, to fix any of these things. But I think it's wonderful, and it's quite a success that we're able to guide them through that experience in such a way that they stay engaged.
What I'm trying to figure out is, okay, how can I balance the kind of critical skills that I've gained through this program? How can I balance that side with the desire to make a difference?
I've always tried to keep a bigger picture in my head of how this is going to affect people.
That's where I see the big picture, especially, but in the lab right now, it requires that I go down to the DNA.
One of my informants called me and he was telling me, please make your work practical to my life. It made me think that, all of what we do academically, it can be very useful to people.
My hope is that the kind of knowledge that we're gaining now in these classes will be the foundation upon which the next generation attempts to tackle these issues.